Here are some tips on how to properly perform a pinwheel assessment. Hi everybody, my name is Dr. Perman. I'm a board-certified chiropractic neurologist and I focus primarily on rehabilitative techniques for concussions, migraines, and dizziness. Okay, so I teach neurological examination here at the college where we go over basic sensory testing, motor testing, reflex testing, and a bunch of other neurological examinations as well. I wanted to dig deeper into how we properly perform sensory examinations, more specifically how we perform a pinwheel assessment. Now, a pinwheel assessment is going to be using a tool like this where we have a pinwheel with spikes on it. And the purpose of this is to elicit a little bit of pain, to test a tract in our spinal cord known as the lateral spinothalamic tract. And this is the tract that carries pain and temperature information up into the brain. Now, this is a contralateral tract, which means if I am testing pinprick sensation on the right arm, I am testing the left lateral spinothalamic tract. Now, as far as how to properly perform these examinations, there are a few things that you need to know. First off, we need to make sure that we are using a fresh, new, sterilized pinwheel every single time we're working on a patient. Now, the easiest way to do this is just by using a disposable pinwheel. You have your one-time use pinwheel, you open it up, you utilize it as many times as you need to for that one examination, and then you throw it out. Now, they do make metal pinwheels that you can use as well. You can use a metal pinwheel if you'd like, but you have to make sure that you're sterilizing it between every single use. So make sure that you have either a UV sterilizer or an alcohol bath to clean your equipment in, or both. But for here, we have our disposable ones. We just use the disposable ones. Next, we need to learn how to properly use our pinwheel. So here we are. The pinwheel is sharp. It has all these spikes. It is not a super pleasant thing, and it can be a little bit scary for a patient to see this pinwheel coming at them. So we need to make sure that, one, we're making the patient feel comfortable. If you just come at them with this pinwheel and start rolling it all over them, they're going to be a little bit freaked out. So before you begin with your sensory examination, it's important that you say, hey patient, this is a pinwheel. We're going to run this along your skin to test your sensation. Now, it's going to be a little prickly, but it shouldn't hurt. We have to make sure that we're not hurting our patients when we do this. They should just feel a little bit of a prickly sensation as they run the pinwheel, which leads me to my next point. We need to make sure when we're using our pinwheel that we're not pushing too hard. It doesn't require a lot of force to elicit the pinprick response. Now, all we have to do is lay the weight of the pinwheel on and roll. The large majority of people, just with the weight of the pinwheel and rolling, that is enough for them to feel the pinprick sensation that we're going for here. Now, in the event that you roll this on them and they just feel pressure, you're gonna push a little bit more, just a tiny bit of pressure to elicit that pinprick response. Now, if you're seeing a row of white dots pop up behind your pinwheel, you are probably pressing too hard, so definitely lighten up a little bit if you're seeing that.